Hi, I'm Dr. Olsen of Edgemont Chiropractic Clinic, and I want to show you a couple of problems when people are sitting and some solutions you can have to make your back feel better when you're doing periods of prolonged sitting. Most of the time when people are sitting, they get in what we call a posterior pelvic tilt. The pelvis rolls backwards, the lumbar spine flexes, and now we have a high compression load on the discs between the vertebrae, and we have kind of a prolonged stretch of the ligaments between the vertebrae. And that prolonged stretch of the ligaments and compression of the discs creates a lot of muscle tension and, again, high compression loads. The better way to sit is in what we call an anterior pelvic tilt, where the pelvis tilts forward, kind of like lifting the tailbone up and putting a natural curve in the back. Now the forces are dissipated on your disc and the forces are dissipated on the ligaments, and you're really held upright just by natural muscle effort. So from that point, it's hard for some people to sit like this all day. And especially if their arms are down on a desk like so, there's the traction weight of the arms on the shoulders and neck. So as a solution to this problem, I've seen this product, which looks really good, and I've tried it. And the Orbital chair kind of solves a lot of this problem. When you sit on it this way, it immediately puts you into an anterior pelvic tilt. It puts a nice arch in your back, and it's impossible to sit slumped. From here, we have our arm rests. My shoulders are unweighted and total relaxation of my upper trapezius muscles. And I can move forward as I'm working on a desk or working on a patient moving forward, and I can keep the natural curve of my back, which takes the load off my discs. It takes the load off my spinal ligaments and prevents my back muscles from tightening up and getting back pain. So this concept here is just great because it keeps my back in a neutral, low load position, which can provide hours of pain-free sitting for people.